joining us. Today we have Nita Ludwig, the administrator at the Rock Island County Health Department. We also have Ed Rivers, the director of the Scott County Health Department. With us also is Sharae Huff, the director of quality at Community Healthcare. All of them will have prepared statements. And we also have Dr. Rebecca Hayes, who is the new Chief Medical Officer at Community Healthcare, who does not have prepared statements, but is willing to answer some medical questions that some of the other speakers may not be able to answer. So thank you very much. And Nita, why don't you start us off with Rock Island County's numbers, please?
Good afternoon. Today, Rock Island County Health Department is reporting 17 new coronavirus cases, and that brings our total to 1,139. Deaths still stand at 30 for Rock Island County, and 10 patients are currently hospitalized in Rock Island County.
In Scott County today, the number released by the Iowa Department of Public Health is 923 cases, and we remain at 10 deaths. Now, from the beginning of our response to COVID-19, before the first cases were ever found in the Quad Cities, we had two goals: to minimize the spread of COVID-19 in the community and to keep the healthcare system from being overwhelmed to the point that it couldn't care for individuals needing care in the community from COVID-19 or other illnesses. We fully expect that the increases in cases over the last 3 weeks will begin putting pressure on healthcare resources in our community. Today, we will hear from one of our healthcare providers in our community and the impacts they are seeing on the front lines. We're joined by Sharae Huff, Director of Quality for Community Healthcare. Community Healthcare is our community's federally qualified health center and is a partner in the QC COVID-19 Coalition. Please go ahead, Sharae.
Thanks, Ed. Similar to what the health departments are reporting, we too are seeing an increase in COVID-19 cases coming through our testing sites. This is not because of an increase in the number of tests being performed. That number has remained consistent for our organization since we started testing months ago. We are, however, seeing a higher number of positive cases coming from those test results. This increase is truly a reflection of what we, the wider public, are doing in our daily lives. All of us really, truly do want to go back to normal, and we want our kids to return to school this fall. We as a community have to take action to achieve that, and simple things like wearing a mask and social distancing truly do make a big difference. Shifting to talk a little bit about the care that's being provided at Community Healthcare or CHC, we are seeing patients predominantly through telehealth at this point, and that will continue. Some services, though, are being provided in the clinics, including pediatric school physicals, dental care, and most OB care. For those patients being seen in our physical facilities, we've made changes to keep everyone safe. Again, we're symptom screening before patients arrive in the clinic. Everyone is wearing masks, lots of hand washing, and practicing social distancing. We are working hard to protect the most vulnerable people in our community. We ask that you join us in that effort by wearing a mask in public.
Thank you, Sharae. We appreciate giving some of the perspective of what's being experienced at Community Healthcare as one of our local healthcare providers. Nita, I believe you also have some information on testing for Rock Island County. Can you share that with us now as well?
Sure. I'm happy to announce that the Illinois Department of Public Health is extending our community-based testing site at the Quad City Expo Center through Sunday, July 19th. This site is at the Expo Center parking lot at 2621 4th Avenue in Rock Island, and the hours are 8:30 to 4:30 every day. Testing especially is encouraged for residents showing symptoms of COVID-19, and these symptoms include fever, cough, shortness of breath, but also chills, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, and diarrhea. Test results will be up to 4 days to be reported, and patients will receive the results, positive or negative, by a phone call. Personnel from the state lab will call the tested patients twice from this number, 888-297-7666, 7208, and I will put that in the chat box, but they will get called twice, but no message will be left because of privacy reasons. However, the patients can call back that toll-free number and talk to the lab to get their results. So they will have to provide their name and date of birth to get those results. This testing site is possible through a partnership with the Illinois Department of Public Health, Rock Island County Emergency Management, the Quad City Expo Center, and the Rock Island County Health Department. And since June 29th, when the site began, they have now tested over 2,300 people. And that is an average of about 258 people a day. So we're very appreciative to have the state providing that testing site for an additional week. Thank you.
Thank you very much, Nita. We have received a couple of questions in the chat, so if any of the media partners have questions, please put them in there. The first one, I'll start with Dr. Hayes, and then we can have public health insert some commentary there as well. Is the primary symptom of COVID still cough and fever? We've heard some other symptoms may be more prevalent.
Yeah, so one of the challenges with COVID is that there's a number of different symptoms, symptom presentations. So cough and fever are definitely there, but we're seeing a lot of just even GI symptoms, diarrhea, rash, just fatigue or subjective fever, meaning that you feel like you have a fever, but you don't actually have one when you take your temperature. So those are probably the most common. I do think the ones that we're seeing positive in-person testing and returning positive a couple of days later are usually cough. Cough is probably the primary symptom. Shortness of breath is a significant one as well, and fever is probably below those two.
Thank you. Another testing question, and this was posed to you, Ed, and any of the others could feel free to answer this as well. What is the difference between a serology test and the kind of test administered by Test Iowa? I ask because they're listed differently across the Iowa reporting sites.
Well, the test that is reported on the coronavirus.iowa.gov is a PCR test. It indicates the presence of genetic material consistent with the coronavirus. A serology test detects the presence of antibodies. Those are not listed on the coronavirus.iowa.gov site, and they may not necessarily indicate that the person had COVID-19. Some of the early serology tests were not very specific. If you'd had a cold, for example, those early tests might have triggered the serology test, and that's why they're not listed on the state website.
Dr. Hayes, do you have anything else you could add to that just to help describe the differences between the two as well?
Yeah, so theoretically, the PCR test, the test that we're doing, up the nose or the back of the throat, whichever way, is looking for hopefully the presence of the person having the virus at that time. When you get a virus or a vaccine, your body then makes things called antibodies that then fight the infection the next time you see it in real life. And that's what the serology test is looking for, is who may have been exposed in the past. There are some challenges that, like he mentioned, it's not very specific. So we're not sure yet if it's picking up exactly that we've seen that you've had the coronavirus in the past. So a lot of work being done around that.
Thank you. We do have two questions that were posed just prior to the call, so I will go ahead to those next. These are both for Ed. Ed, the Scott County Board is set to vote on a mask mandate tonight, either for county buildings or in its entirety. Where does the health department stand on this issue?
From a public health perspective, CDC and the Iowa Department of Public Health encourage the use of face coverings when individuals are unable to stay at least 6 feet away from others when they're in common spaces. Scott County Health Department continues to recommend face coverings as we encourage our community to play their part to help us slow the spread of the virus.
And then there was a follow-up question. Would it be more helpful or clear if the governor issued a statewide mandate or clearly allowed counties or cities the option to do so?
We recognize there's lots of questions right now about the wearing of face coverings, and we're focused on continuing to share important public health messages that will help protect the health of our community and slow the spread of COVID-19.
there's any other questions for Dr. Hayes, Sharae, Ed, or Nita, please type them in now. Okay, with no additional questions, we'll go ahead and conclude today's briefing. We appreciate very much that our partners are on the call to help share the important information, especially as we're seeing this marked increase of cases in the community, and we appreciate the media and all your attempts to share this information with the community. Again, we'll continue sharing messages with you, and we'll be in touch next week for additional press briefings that will be taking place. So thank you, everybody. Have a good afternoon.